Hello, you guys. Here is our NCLEX style question for today, presented by Apex Nursing Academy. The RN receives a call from the PACU nurse stating that a client is returning to the unit. The LPN plans to assist the RN to take which action first on arrival of the client. Now, anybody that knows Apex Nursing Academy knows the number one test taking strategy is to repeat the question. Do not drop down and start trying to pick an answer after you skim through the question. Repeat the question and then go right into recognizing your cues and analyzing your cues. Now, recognizing cues just means you want to pick up the significant data from the question and then you analyze those cues, bring all your nursing knowledge to the forefront about those cues, and then you go into answering the question. So repeat that question and start recognizing your cues and analyzing your cues, which I've already done here. We're talking about the PACU nurse, client returning to the unit. The LPN plans to assist the RN, and they're asking about which action first on arrival of the client. Which action will the LPN take? So let's think about those cues. The PACU nurse. This is given a time frame. We're in the post-op period. The client is returning to the unit. Again, this is giving us a time frame when we are taking care of this client. We are in the post-op period. And remember, in the post-op period, we want to be preventing complications. We want to be really assessing this client, keeping our eyes on this client to pick up on signs, pick up on symptoms to prevent complication using your assessment and everything in your toolbox that you can to take care of this client. LPN to assist the RN. Just remember that they're asking about which action the LPN or LVN is going to take. So just think about the scope of practice for an LPN and first action upon arrival. First is a key word because that is a priority clue. So they want to know what are you going to do first. And when we think about prioritizing, you always want to use your priority resources, which are your ABCs, airway, breathing, circulation, your nursing process, and Maslow's. You can use any or all of those to really pick the best answer choice. Now, if we just go through these answer choices, check the dressing to assess for bleeding, check tubes or drains for patency, assess the patency of the airway, and assess vital signs to compare with pre-op measures, all of those really can be done. None of those are anything that I would say you would not do. All of those things that really need to be done. So we can't eliminate any options saying that it does not apply, but it's asking about which action first. So that means we need to prioritize all of these actions. Since all of them can be done, which one are we going to do first? Now, think about our client is in the post-op period. The post-op period, a main complication in the post-op period is respiratory problems. So airway is always a number one priority. So if we think about airway, breathing, circulation, airway really stands out because assess the patency of the airway is pretty direct on answer choice C. So if we look at all these answers and we say, hey, all of these can be done, well, let's prioritize the order in which we're going to do them. And of course, if we think about ABCs, we're going to assess the patency of the airway first. Then we can assess vital signs. Then we can check the dressing for bleeding. And then we can check the tubes and the drains. So if we use our nursing knowledge, we use our ABCs, that is going to guide us to the correct answer, which is assess the patency of the airway. When you're doing these questions, you got to think like a nurse. You got to trust your nursing knowledge and you got to use your cognitive skills. When you do that, and the more you do that, the better you will get. you will be able to master answering these type questions. So use your cognitive skills, keep practicing, get better and better, and I will see you next time. Bye bye.